Hello everyone. So today what I'd like to talk about and answer some questions concerning facial dermal fillers and the COVID-19 vaccine. We have received many questions regarding concerns about the latest reports with people developing facial swelling. So let me share a little bit of information and history because I think it's very important for everyone to have fact versus fiction so that way people are not confused, concerned, or worried. Number one, the phase 3 trial of Moderna is the one that they saw and reported 3 out of 30,000 people reported facial swelling after having dermal facial fillers. Now, they did not report as to what was done first, the actual fillers versus the vaccine and so forth, but obviously it seems like people had the fillers already placed. I'm not really sure when or how long prior to their vaccination process, but then they went and got the vaccine. They triggered an immune response, which is what the vaccine is supposed to do in order to fight the virus. And those people then reported the actual swelling in the cheeks and lips. So that we do know. So if you do get facial swelling, it's going to be limited to cheeks and lips so far as what has been reported. According to allergy and immunology, including even at the prestigious Emory University, the allergist immunology department has reported the fact that when you trigger an immune response, just as with any vaccine, the mRNA is triggering an immune response in your body to fight the virus. Your immune response will also fight or attack or respond to any foreign substance, that including dermal fillers, which are pure hyaluronic acid. So that is not such a bad thing in the way, because at least we know that your immune response is responding. Some people have more reactive of an immune response than others, and that's something that is not predictable. I myself do have facial fillers, and I did also get the Moderna vaccine and have not had any problems with swelling. That being said, does not necessarily mean that it applies to everyone, because we each have a different response. When you trigger an immune response, you can get any kind of side effect. This is not considered a serious side effect for several reasons. Number one, it's a temporary mild swelling. It does resolve on its own. They did not seem to have to treat anyone with an EpiPen, so it is not an allergic reaction. If people are concerned about the length of the swelling, they can always take an antihistamine, or some have actually recommended to even give them oral steroids. According to certain institutions in Europe, England, and Canada, what some people have been doing for their patients is actually recommending for them to take an antihistamine the day before and the day of their dermal facial fillers if they're going to be getting their fillers after they've had the vaccine, or if they've had the fillers in the past and are coming for the vaccine, and so forth. So it's really about timing. Other institutions have recommended that people wait to do their vaccination either 4 to 6 weeks after their fillers for the first dose, or you can wait 4 to 6 weeks after your second dose of the vaccine before you actually get your fillers. Either way, it is not a reason to postpone your vaccine, and nor is it a reason for you to stop doing your fillers. We know, according to literature, that any hyaluronic acid filler has the predisposition to cause swelling, as well as reported incidences of 0.5% of potential granulomas, swelling, edema, and nodules. And that's even without a vaccine. All other vaccines have the potential of triggering swelling, but they just have not been recorded, or people have not really been concerned about it. According to the American Society of Plastic Surgery, about 2.7 million or more people a year get fillers. So it's very early in the game for us to actually see what true percentage of people are going to have an immune response to the fillers versus those that are not. So far, if it's only 3 out of 30,000, which means a 1 in 10,000 incidence, and it resolves on its own, so it's nothing to be concerned about. So to answer everyone's questions, can you get dermal fillers and the vaccine? Yes. How long should you wait? That is something that you should discuss with your practitioner, because everyone has their different guidelines in order to be on the safe side. If you have questions, please feel free to send them to us. We are more than happy to answer those and to share information in order to alleviate any concerns or fears. Thank you very much.